I'm Mark Campbell. I'm a medical oncologist in Grand Rapids, Michigan, and I'm going to help you understand about immunotherapy. I wanted to talk briefly about, in a cartoon way, not a comprehensive way, immunity. That's thankfully, we've been looking towards that breakthrough for 35, 40 years, as long as I've been a doctor. And thank God the last 5 years we've seen some very fruitful progress in that area. So that's very exciting. So I want to talk a little bit about our immunity. And we often will take, I like that, being my age group, think in terms of Pac-Man. Pac-Man was kind of the game back in my era. And our immune cells are like Pac-Man in that they're moving around that board looking to devour the bad guy. Sometimes the bad guy is an infection cell, polio, tetanus, something like flu, like that. And sometimes it's a foreign cell that doesn't belong to our body. Again, being fearfully and wonderfully made, all of our cells almost have a fingerprint on the surface that identifies it as myself or you. And if we switched body parts, like we sometimes do with transfusions or other therapies, we can trigger a reaction by the body saying, hey, wait a minute, that isn't you, that's somebody else. And so that our immune cells are going around actively surveillancing for bad guys. And they're, for the most part, trained to do a sniffing job. I think the dogs at the airport sometimes sniff guns and sometimes sniff drugs, but they're trained for usually one or two items only and not the broad spectrum. So we have immune cells that are often trained to identify a different enemy, and it's working all the time. You know, certain illnesses, our immune cells are just down, so they are born with inactive immune cells or lesser numbers of immune cells, and that's a production problem, so to speak. Today, we're beginning to understand how certain tumors, through different breaks in their DNA, create a way that they can hide, so to speak, from our immune cells. And if we have a tumor cell that should be immediately recognized by our immune cells as being foreign or not belonging there, if this tumor cell was able to create what I'm going to call it kind of a contemporary force shield, if it can create a barrier so that the enemy can't recognize it, it can go on growing. And part of our immune cell can, so to speak, be blocked, almost like a brake is on, not allowing this immune cell to do what it would normally do in recognizing and taking out the enemy. And we have created now some medicines that in our immune system create a lever to turn on and off this brake switch. So in essence, it can remove the obstacle that is blocking our normally functioning immune cells from taking out the enemy. And some of the TV cartoons showing how that works, you see almost like when you throw in food at feeding the fish with the kids, they're going crazy as they're all jumping at the food. And now suddenly all of these Pac-Men are taking out the bad guy because we've been able now to understand better that immune reaction and blocking that's taking place for the cancer, and developed a number of ways around that block and that what I'm calling force shield decoy from that. So there is tremendous promise, not only already, but on the horizon for our ability, through different breaks in the DNA of the cancer, to create ways that our immune system can take out. And the nice thing, too, about that group of medicines as a rule, they're far more gentle than some of the chemotherapies that we've lived with over the last few decades.